YouTube, it's Nathan. It is Thursday, and today marks my 9 months on T. Officially, it's the 20th. And guess what, y'all? I am so sad today. Like, boo hoo, I was just crying sad. It was my hearing day for my appeal to get my top surgery, and of all the things that Nathan can miss, he missed his hearing. How did I miss it? I had the times confused. What the hell? Like, how did that happen? I'm gonna tell y'all how. It has been a hectic couple of weeks at home. There's been a lot going on, and it's been things going on in my relationship that's stressing me out. Not to mention all these things that I've had to try to accomplish really quick for my top surgery. Not to mention I'm constantly in pain, and on top of trying to get prepared to go back into the work field because I'm knocking out appointments so that I can work. I'm still waiting on word back for my background check. So while I'm waiting, I have scheduled some interviews for some other positions because I need to work. So yeah, I miss my hearing, and I cried and I cried and I cried. This is how. I had the impression that 2 o'clock was my hearing time. Apparently, no, it's 11. It's marked on my calendar. I even had the audacity to look at December this morning, but did not look at my hearing time. In my mind, I programmed 2 o'clock, and I was so wrong. And I am so upset, y'all. Like, I really would cry on camera. But that's what happened to me today. And to update y'all on a good note of my hearing, I went to see the breast surgeon yesterday, which is another reason why I got thrown off. Because I sat with her, and after talking with her and talking with her and talking with her, I got her convinced that all I need is a letter showing that my pain and suffering and numbness in my breast on the left side, my man boob, and my back is causing harm to me, and is making my everyday life horrible. She told me that I should stop binding. I looked at her and said, not unless you want to be responsible for me going into the psych ward, because that's where I would be, in the psych ward. And no, I can't not bind. I showed her my compression shirt, let her know that I'm binding properly. So it's not the case of the fact that I'm binding, because had I not had surgery, I would be okay, I would think. But since I had surgery, she noticed that there was some issues with my aftermath of the surgery that's causing the pinched nerves, but we know this already. So after a good talk with her, and after wanting to just scream for a minute because I thought she knew what it was already, she agreed to write the letter that I need. And she's also referred me back to my original surgeon who did my surgery. Not to knock Akron plastic surgeons, they are wonderful. And I don't know if I should say it on camera, but just the way my body healed and what happened to me is the reason why I chose Dr. Medali. Not to mention Dr. Medali specializes in FTM surgeries, so he's good at what he does, and he was my chosen doctor. But apparently I'm being sent over to my original doctor to have him evaluate and send his opinions and see what he says, as far as also helping towards getting my mastectomy covered. But there's a lot of buts in there. What my insurance only requested was medical documentation stating that I'm having an issue. So her letter, as well as the radiologist's letter, should be good enough. But she still wants him to take a look-see. And because I missed his hearing, y'all, it may look like I have to go see him anyway, because I may have to start all over from scratch, just resubmitting the request. The only good thing about that is if that's the case, and Doctor, I won't even say his name, but if Doc agrees that okay that you can benefit from this surgery, and he sends over a request with his information to my insurance, they very well might just go ahead and cover it right away. Trick about that is I would be stuck here in Akron doing my surgery again with my original clinic, and but like I said, their work is great. So it wasn't a case about their work and the things that they do because I've seen it. Otherwise, I wouldn't have went in the first place. It's just my particular experience. But hey, sometimes you got to give a physician a second chance, and if that's the case, they end up happening, I will have to do that. But we have to have a long talk first. So this is just a quick couple of minute update, y'all, to let y'all know what's going on. Is there any changes since a few days ago? Other than the fact, y'all, that I'm losing weight pretty rapidly down my at the bottom half, and I just realized that. Like, I gotta get on the scale so I can see exactly how much I weigh. But my pants was falling down yesterday, and those pants never fall down. So there's been some quick fat redistribution that it's caught me off guard. So yeah, I gotta see what I weigh. I might not look from looking at my face like I lost anything, but trust me, y'all, when I say I have lost a good nice amount of weight. I have, because I'm down a couple of pant sizes, so that's good. It's just I hate that my fat is coming to the front. Like my stomach, y'all, is shifting. It's weird. But I'm working on it. And I've continued just lifting weights, y'all. So yay for me keeping focused. Relationship wise, I hate to talk about it because if she looks at these videos, she is going to want to kill me. And I think she has, according to my son. But anywho, it's my channel. It's my opinions about my life and how I'm feeling. And I vent here. And I'm man enough to say what I want to say, and I'm man enough to accept responsibility, and that's how it is. But I'm going through it, and going through it, and going through it, and it's stupid stuff at times, and it's crazy, and it's another reason why my mind is so off track that I'm not focused the way I need to be. So pray, y'all, that it gets better for me, because I am going to lose it. But yeah, so shout out to all my homies. I love y'all, and I hope y'all have a good weekend ahead. It is Thursday. I'm on my way now to go pick up some paperwork from the breast center at the hospital. It's the paperwork that I needed. And I'm just going to wait and see if my hearing's rescheduled, and we'll take it from there. But I'm thinking maybe I might get lucky. I don't know, but I'm not too optimistic because something like this was important. There's no way I should have missed it. And believe it or not, it was something as simple as a time. Yeah. So, yeah, Nathan is not happy today. I straight wanted to take a shot. I'm not even gonna lie. If I was a weed smoker, I'd have hit a blunt real quick. But I'm not gonna do either because I have to get my blood pressure to continue to get better. And yesterday, because I was stressed, and I was stressed the night before, it kind of rose to 171 over 102, even though it was stabilizing. So I have stress-induced hypertension. It was not hereditary. It is something that I developed after having a C-section and drinking some caffeine, not knowing that it can trigger hypertension. And it did. So, because I had a panic attack. So, yeah. That's what's going on with me today. Nate then missed his his state hearing for his top surgery. I know y'all want to just smack me in my face for that, because who misses an appointment like that? Who misses it? We want these surgeries bad, so who misses it? So y'all know, just I feel like shit, like literally like awful. Like y'all can't even imagine how bad I feel right now. And I'm home with just my son. I went and picked him up, so I was kind of alone and needing somebody to talk to, and just I'm calling. I called a couple of people just to see if somebody had answered, just to talk to me, because I just needed someone's just encouragement right now. But it's all good. I'm gonna be all right. I had to say a prayer on it, but yeah, I missed it, and I'm feeling okay. Other than the fact that I am just sad, depressed about this appointment, hearing that I missed. But on the good notes, and if I have to start over, it won't be too hard of a process. And I do have doctors supporting me, so that helps. So it's not No go is just Nathan missed his hearing, so Nathan needs to just sit down and cry a little bit longer for a second to feel a little better and scream maybe because yeah, when my doctor, just a funny, it wasn't really funny, but just to jump to what happened at my appointment, my doctor laughed at me and she said, well, you can just wear big shirts instead of binding, because binding is going to continue to ruin your nerves. Yes, my nerves are being pinched so bad that my back and arm is going numb. And when I tell you it scares the shit out of me, it does. And she said, well, you can just wear big shirts. And I'm like, lady, look at me. Do I look like somebody who wants to go outside with breasts hanging out? A big shirt, it's not going to cover them. Am I one to look like I want to go outside without a binder on? Really? I said, no, I don't think so. I am a man. I don't want to have man's breasts. The bad thing is they don't even look like man's breasts. They look like breasts. So they're small, but they look like breasts. So come on now, really. But yeah, she had the funny nerve to do that to me yesterday. So that didn't help. It didn't help me at all. But in the end, I got my goal accomplished to get what I need from her. The radiologist was already going for it, so I got to pick up her paperwork. And if I would have made it to this hearing this morning, I would not have had them documents. So that makes me feel a little bit better. They were not ready for me to pick up. So hopefully I'll get the blessing to get it rescheduled. That way I'll have my surgeon's information as well as my breast doctor. Well, she's a breast surgeon too. I'll have her information and the radiologist's information called combined, all giving me the go for it with getting some corrections. My surgeon said, well, thus she said, my original surgeon who did my reduction is a male, but the lady I saw yesterday said, because I'm trying not to use names, that even though it's unethical because she deals with oncology, which is cancer issues, that it's unethical for her to recommend a mastectomy. She did recommend that treatment be done, and she gave me. I broke a nail, y'all. No. Anyway, I'm such a big baby. Anyway, she gave me a prescription for medication to help with the pain and with the nerve issue. But she said it won't heal. It won't heal. It may not ever heal, but it will get worse. But she said it'll help me try to cope with it. But I'll be out of it. And I'm like, So she is trying to follow me. I have to follow up with her. But she said she is going to do as much as she can with that letter. So I can't wait to go get it. That's why I'm going to get it instead of having to mail it to me so I can take a look. And if there's anything that she left out, I can let them know. Can she fix it beforehand? So yeah, I just talked. 13 minutes in and I'm about to go because I got to get over there soon before my dear medical assistant leave, and I can't get the information until tomorrow. So yeah, that's what happened to me today. And pray for me and my relationship. If you pray, wish me well, something, because right now I just am down in the dumps. My issues at home and the things I go through is distracting me, even though I'm trying to really get focused. So yeah, that's it. So I want y'all to have a good weekend and happy Friday when it's coming, and be safe, and shout out to all of you. And I'm going to cut it off now. Bye.